One of the biggest things for us was we said every patient, every prescription should be digitized. Even if it is written on a paper, it has to be digitized, right? And what it does is it makes the doctors extremely conscious. They makes them more careful. They makes them more available because they are going to have a digital signature that this is their prescription. They can never go away from it.
You are significantly investing in technology development within Pristyn. I think you have a team of more than 100 folks working on various technological stacks. Have you seen these investments resulting into tangible, measurable outcome like bringing in operational efficiency or improving patient outcomes? Can you talk about some of such?
Massively. और मतलब I think एक ये again maybe because of the background and nature of work in the past, fundamental belief है technology में. So right from, and I'll tell you where all places we use. First of all, all these care coordinators who join us, we use an AI built model to train them. So it's a completely AI built training method. So they train them. Second, we have built a huge layer of patient management. We, like we said, we talk to 30,000 odd patients a
Wow.
day by like 500 plus people. So whenever they talk to those patients, their conversations, their interaction, the information, everything gets recorded, and you use those distribution funnels to divide those patients into right set of people based on geography, based on speciality, based on skill, based on availability, based on region of where the doctor is or where the patient comes from. So that's the path. Then we use a huge power of technology in the entire doctor ecosystem. So doctors schedule, every doctor sees his or her schedule on their own app. Then they do the entire EMR. You know, one of the biggest things for us was we said every patient, every prescription should be digitized. Even if it is written on a paper, it has to be digitized, right? And what it does is it makes the doctors extremely conscious. They makes them more careful. They makes them more available because they are going to have a digital signature that this is their prescription. They can never go away from it, right? So the entire EMR is in-house built and everything is solved. Then we did the entire hospital mapping with technology. So let me give you an example. uh, a patient who's a 60-year-old undergoing a knee replacement with, let's say, a cardiac disease might need a different hospital than a patient who's 30-year-old absolutely fit undergoing a circumcision. Now when we are blocking their hospitals, then the patient has to, or the coordinator who's just fixing the hospital in the system, he has to make these choices. They all happen automatically. Otherwise he can't say, okay, I have in Delhi I have 20 hospitals and let me choose from where it comes. So technology doesn't allow him to choose a hospital where the patient safety is compromised, or patient safety for that patient for that disease is not up to the mark. It is as simple as saying for a knee replacement you need a different kind of an operation theater, and this hospital might have not have it. Sure. So you cannot fix the surgery there or can't block the surgery there. Then there is a lot of modules around patient safety. That means all the EMRs are in the system. Our system already reads that, these are the systems recorded by the doctor. This is the patient's background. This is the treatment the doctor has suggested. Does it match our background or not? And whenever there is a red flag, so we have a huge medical directorate who looks into these compliances and keeps making those mix and match changes. That, okay, if the doctor has made an exception, is there a real reason? There's not a real reason. Then there is an entire insurance play. Like I said, when you submit your insurance document to a system, within 30 minutes, 30 seconds, we will tell you your insurance covers this amount, this disease by this one hospital. Very interestingly, you might have the same insurance card, same company's insurance policy, but it might be corporate. That means maybe your employer gave you are working somewhere, or you bought it retail. Your policy is same company, both in retail, but you bought a different policy. You are in the same hospital, or you are two people, everything policy is same, different hospital, different insurance coverage. Same policy, same company, same hospital, different disease, different coverage. So there is so many permutation combinations.
Wow.
There are 30 plus insurance companies. There are 150 plus elective surgeries which we do, and there is all like 1,000 plus hospitals. So multiply all this, that's the number of permutation combinations
Wow.
we run on daily basis. So technology makes us seamless of pre-auth and patient this claim processing. Then there is an entire medical documentation from operation theater, OT notes to discharge summaries to post authorization claim processing, which all happens through technology. Then there is patient information flow. Before a patient gets to the hospital, all the KYC documents, all the payment processing, all the patient prescription go to the hospital so that the admission can happen in under 30 minutes. Then the same process happens in discharge. Then the entire patient history is there with the patient experience team so that when the patient gets home, they can reach out to the patient first week, second week, third week, sixth week, then eighth week, finally to say the patient is doing okay. Or if a patient raises some complaint, then the entire patient journey is with the doctor. When did he come? Which hospital was he operated? What kind of treatment I gave him, what is his OT notes, what is his discharge summary. So the doctor can look at the entire background.
And all this is built in house.
Everything is built in
Wow.
house. So everything is built in house, and then there is, maybe I missed a few, but then there is the ground team, right? The ground team which onboards hospitals or partners with the hospitals. So they have a huge digital checklist of saying, okay, this hospital on this road, this is the accessibility, these are the beds, this is the operation theater, it's an ABH, these are the licenses. All happens through compliance. And then of course, as you've been a part of large technology companies, when we have so much data being generated, we have a massive BI layer. We have massive dashboards. Everybody has I have this. I had one of our ex-Pristyn colleagues who has joined a large institution today, and he said, "I get this OPD sheet of a patient and then an IPD sheet of a patient, and I have to manually cross-check जो patient मेरे साथ surgery कराने आए थे, ये OPD कब कराने आए थे, और उनको डॉक्टर ने क्या बोला था, और उनकी प्रिस्क्रिप्शन क्या है. I can't match it in my system. That little simplistic thing, which for us should be like, oh, this is very simple. But healthcare, I think some of these things we've been able to do it fairly well. So technology is it's a core of our existence.